So before you see me in the office, and once I see you, you'll notice that I usually like you to get X-rays, MRI, CT, and if you're having surgery on the low back, like a disc replacement, I want you to get a bone density test. Oftentimes, patients ask me, why do I need all three X-ray, MRI, and CT? Don't they show the same thing? The answer is no. What exactly do they show, you might ask? An X-ray is important because it's of you standing up, and I have you flex and extend the spine. So I'm able to see if there's any sort of curvature like scoliosis, and I'm looking for disc height collapse, and I'm looking for any sort of instability or listhesis like an anterolisthesis. An MRI is best for a three-dimensional view of the soft tissues like the spinal cord, nerve roots, and discs. It can show me disc herniation. It shows me the bone, but not quite as clear. And if there's a disc herniation, for example, it shows up dark on the MRI. That may actually be a bone spur versus a disc. I can't really tell on the MRI. That's where the CT comes in. A CT shows me a three-dimensional structure of the bone. So that'll show me if there's any fractures, like a pars fracture, for example, in the lumbar spine. It'll help me look at the facet joints for facet joint arthritis much more clearly than the MRI does. And it will show me bone spurs. I can differentiate bone spur versus a disc herniation. And if you're having lumbar spine disc replacement, I definitely like to get a bone density test. I can measure the bone density from the CT, but sometimes I'd like to also have a bone density test.